Welcome to the Deep Dive, where we sift through a mountain of information to bring you those essential nuggets of knowledge.
Glad to be here.
Today, we're embarking on one of life's most incredible and, let's be honest, often overwhelming journeys, welcoming a new baby.
Mm-hmm.
And while it's a time of immense joy for many new parents, it quickly becomes, well, a whirlwind of questions, exhaustion, and sometimes unexpected challenges.
It's truly a transformative period, yeah.
Yeah.
And understanding the landscape of support and potential hurdles, that can make all the difference in feeling prepared and, confident.
That's precisely our mission with this deep dive. We're going to navigate the unique world of community support, common issues, and essential health information for new parents and babies,
Yeah.
specifically within New Zealand.
Right.
We've distilled a comprehensive expert lecture on this topic into what you really need to know to feel well-informed and hopefully far less overwhelmed.
Our source material is designed to give you a foundational understanding of the New Zealand context, sort of cutting through the noise to the core insights.
Okay, let's start by grounding ourselves in the sheer scale of new life in New Zealand. We're talking about roughly 55,000 to 60,000 babies born every single year.
It's quite something.
Just in the year leading up to March 2025, there were 58,539 live births. That's a natural population increase of over 20,000 more births than deaths, not even counting migration.
Yeah, it paints a picture of constant new beginnings across the country.
What's truly interesting here when we look at the broader trend is that after a general decline in birth rates for some time, New Zealand actually saw a small baby boom during the COVID period.
Mm-hmm. That's right.
And now the fertility rate has seen a slight, kind of unexpected uptick, moving from 1.54 to 1.58.
It speaks to a certain resilience in family planning, maybe? Or perhaps just a statistical fluctuation. It's hard to say for sure yet.
It's a fascinating societal pulse point, isn't it? And if you look at the ethnic breakdown of these births,
Yeah.
while European births are still the highest, Maori and Asian births are remarkably similar in number and are steadily increasing, as are Pacifica births.
It's a vivid snapshot of New Zealand's increasingly diverse future.
It absolutely is. However, this demographic picture also brings into sharp focus a critical public health concern: the infant mortality rate.
Yes, this is quite concerning. There was a very significant jump last year.
Nearly doubling, I read, from
Yeah.
3.5 to 6.0 deaths per 1,000 live births.
That's correct. It's a stark figure and a sobering reminder of the vulnerabilities newborns face.
That infant mortality rate is indeed a tough reality to confront. But what's truly remarkable, and perhaps where New Zealand really shines, is the unique architecture of support it has built around new parents and babies, starting with the Leap Maternity Care, or LMC, system. Can you help us understand how this works? It's quite different, isn't it?
It really is. What truly distinguishes this system is that, unlike many other countries, where you might simply get whoever's on duty at the hospital, New Zealand's approach means a pregnant woman chooses one lead professional, her LMC, and that person provides and coordinates her care throughout the entire pregnancy and for the first 4 to 6 weeks post-birth.
Wow.
And this entire personalized service is funded by the Ministry of Health.
So it's that profound continuity of care. The person who's going to be with you, often the one who attends the birth.
Exactly. For listeners in other countries, it's a fundamental shift. It fosters a much deeper, more personalized relationship and builds a sense of trust right from the start.
The LMC often feels like a true partner in the journey then.
That's the idea, yes.
Yeah.
And the vast majority of LMCs, around 85%, are community midwives.
Okay.
This is a significant historical shift. Back in the 1990s, GPs used to fill this role more often.
Right.
But now midwives predominantly take on that holistic responsibility. It really shows the system's focus on consistency and specialized care.
And it sounds almost universally adopted. I heard 98% of women are enrolled with an LMC.
That's right.
And if you show up to the hospital without one, it's actually a notifiable event, like it gets flagged.
Yes, it flags that there's been an unusual deviation from the standard care pathway. LMCs also have quite a broad scope. They provide counseling, vital education, birth support.
Can they prescribe things too?
They can, yeah, within their scope. Though in practice, for most, it's primarily vitamins and paracetamol, unless it's something directly related to pregnancy or newborn health.
Got it. Beyond the LMC, there's also the Wellchild Tamariki Aura program, which sounds like a crucial next step in this support network.
It is, absolutely. And it's free and nationwide for all New Zealand children from birth up to 5 years.
5 years, okay.
It includes 13 core visits, Your LMC or midwife will handle the first 6, covering immediate post-birth care and the initial 6 weeks.
And then.
After that, care transitions to a GP or a well-child provider like Plunkett for the ongoing checks.
And these visits are important because
They're absolutely crucial because they act as a gateway to specialist health services if needed, and they're closely linked to the child's immunization schedule, ensuring that ongoing health monitoring.
Plunkett. I've certainly heard that name a lot when talking about New Zealand. What makes them so central?
Plunkett is indeed a cornerstone of early childhood support in New Zealand. It's the largest nonprofit provider of services for children under 5.
Right.
And their presence is almost ubiquitous. Historically, almost every tiny town had Plunkett rooms, though many have been repurposed now.
What kind of things do they offer?
Oh, an incredible array of services. Practical things like toy libraries, car seat rental, community connectors like play groups,
Yeah.
and even a 24/7 Plunkett line for advice.
Wow, 247. That's amazing.
It's a fantastic, free, and accessible resource for parents. Really vital.
Okay, let's turn our attention to the first days and weeks for new parents, particularly mothers. The sources paint a picture of a real roller coaster, both physically and emotionally.
It truly is. Post-birth, mothers often navigate a complex mix of intense emotions. Tired and overwhelmed, yes, but also excited, perhaps fearful, and certainly confused at times.
And physically?
Physically, there's a lot to recover from. Things like lochia, which is post-birth bleeding that can last up to 6 weeks. And the after pains as the uterus contracts back down. If there's been a C-section, there's the added layer of surgical soreness and restricted movement, which is a significant challenge in itself.
And the hospital stay provides that critical initial recovery period.
Absolutely. A minimum of 4 to 6 hours post-birth is required due to the risk of hemorrhage, which is highest in that immediate period.
Right.
C-sections typically require a longer stay, usually 2 to 3 nights, to ensure the mother is mobile and recovering safely.
What about home births? Are they common?
They happen. Around 3% of New Zealand women choose a home birth, but it's worth noting that a significant number of those still result in a hospital transfer if things don't progress as straightforwardly as hoped.
Okay. Now, breastfeeding. It's often presented as this natural, easy thing. But the sources make it clear that's not always the reality. What are the core benefits, and just as importantly, what are the common hurdles that catch new parents off guard?
Well, the benefits are profound. It's free, safe, easily digested, and incredibly adaptable. The true marvel is how it changes, like minute by minute, to meet the baby's precise needs.
Oh, amazing.
And colostrum, that first milk, is packed with the mother's protective antibodies, offers immediate defense against infection, reduces allergy risk. It's powerful stuff.
It's pretty amazing how the body adjusts, isn't it?
Yeah.
I've even heard that a woman's body can theoretically produce enough milk for triplets. How does that demand and supply thing actually work?
It's a powerful feedback loop, basically. The more the baby feeds, the more milk the body gets the signal to produce. It adapts.
But as you said, not always easy.
No, definitely not always easy. Milk can take 2 to 3 days to fully come in, so babies initially get smaller amounts of that antibody-rich colostrum.
And common challenges.
Things like engorged breasts, latching pain leading to sore or cracked nipples, and for this, lanolin is highly recommended. It's safe, it's soothing.
Lanolin, got it.
You can almost map the common challenges just by walking down the baby product aisle at the pharmacy, can't you?
Huh. Yeah, you really can. All those creams and gadgets.
Precisely. Other hurdles include blocked ducts, which can be quite painful and lead to mastitis.
Ouch.
Flat or inverted nipples, where nipple shields can often help. Tongue tie is surprisingly common in New Zealand and can often be addressed with a minor procedure.
And low milk supply. What's the advice there?
The best advice, perhaps counterintuitively, is often simply to keep feeding. That stimulates production. Rather than immediately reaching for supplements, persistence is key.
So if breastfeeding isn't the chosen path or isn't possible, what about bottle feeding and formula? The Ministry of Health has a specific recommendation, don't they?
They do. They recommend exclusive breastfeeding until around 6 months, then continued breastfeeding alongside solids until at least 1 year.
But if that's not happening,
If not, then commercial infant formula is needed until the baby is 12 months old. Cow's milk isn't suitable before then.
right.
The government also actively discourages the marketing of infant formula for babies under 6 months to promote breastfeeding, but it's always emphasized that it's ultimately the parent's choice.
And for babies who aren't gaining weight, those failure to thrive babies, formula might actually be recommended by a doctor.
Yes, in those specific cases, it can be a crucial intervention. Absolutely.
And for any bottle feeding, sterilizing is key, right?
Essential. To prevent infections. Microwave sterilizers are a popular and easy option for new parents who might not be aware of this step.
Do you have to warm the formula?
Actually, no. Many people do because breast milk is warm, but it's optional. Babies can drink it cold or at room temperature. Fine either way.
Are there special formulas?
Yes, specialized formulas for allergies exist, though the government has recently clamped down a bit on overprescription to ensure they're used appropriately. They usually require a prescription.
So, whether breast or bottle fed, how does a new parent know if their baby's actually getting enough to eat? What are the simple signs?
The signs are quite straightforward, thankfully. If they have enough wet nappies,
Okay, how many's enough?
generally looking for about 6 or more in 24 hours after the first few days.
Got it.
Also, if they aren't crying right after a feed and generally appear happy and full, seem content, they're very likely getting what they need. Trust those simple indicators.
Okay. Now, while the physical recovery after birth is paramount, what often lurks beneath the surface and is perhaps even more challenging for new parents is the profound impact on their mental health. It's not just baby blues, is it?
No, it's much more complex than that, and there are distinct categories we should talk about. Baby blues, or maternity blues, is incredibly common, affects almost every woman to some degree.
Really, it's almost everyone.
Pretty much. It's a brief period in the first week post-birth, characterized by feeling down or tearful. It's due to those rapid hormonal shifts.
I think you mentioned an anecdote about that.
Ah, yes. I remember vividly crying in the supermarket over a display of flowers once for absolutely no reason other than that hormone fluctuation. It usually passes within a few days to maybe a week or two.
And if that profound sadness doesn't pass, that's when it can escalate to something more serious, postnatal depression or PND.
Exactly. PND is more serious and surprisingly more common than many people realize. Symptoms often mirror general depression. A sense of isolation, withdrawing from friends and family, feeling profoundly overwhelmed.
Tired but can't sleep.
That's a classic one. Tired but wired, paradoxically unable to sleep. It's a persistent cloud that doesn't lift like the baby blues.
And then there's the very rare but truly severe postnatal psychosis. What does that involve?
Yes, postnatal psychosis is extremely rare, but involves severe symptoms of psychosis and mood changes, usually appearing quite quickly within 2 weeks of birth.
And needs immediate help.
Immediate medical attention. It's very serious. There was a tragic case in the media recently that highlighted just how devastating it can be if not addressed swiftly.
What are some of the key factors that put new parents at a higher risk for PND?
Several factors can contribute. A pre-existing history of depression or other mental health issues is a significant one.
Okay.
Lack of social support, maybe relationship difficulties, those can play a big role.
What about the birth itself?
Yeah, a complicated birth, maybe an unexpected C-section, that can be a traumatic and overwhelming experience, increasing risk. And finally, having a particularly fussy baby who struggles with sleep or has colic or reflux can be a significant ongoing stressor.
And this isn't just a challenge for mothers, is it? Dads can experience it too.
That's a really important point to stress, yes. While statistics might focus primarily on mothers, up to 1 in 20 fathers can also experience postnatal depression. It truly impacts both parents.
So if someone is experiencing these symptoms, what's the typical pathway for diagnosis and support?
Well, often screening tools like the Edinburgh Postnatal Depression Score, or EPDS, are used. They're quite common in clinics. Studies using these have shown a surprisingly high number of women meeting the threshold for PND when screened systematically.
And treatment.
Initial treatment often focuses on enhancing social support and psychological therapy, especially for milder symptoms. For moderate depression, SSRIs antidepressants are often considered.
Which ones are okay with breastfeeding?
Sertraline or escitalopram are generally preferred because they have a better profile regarding compatibility with breastfeeding.
And pharmacists can actually play an enormous, often overlooked role here, can't they? They're often the first point of contact.
Absolutely. Pharmacists can be a vital first line of support just by checking in with new parents, asking, how are you sleeping? How are you eating? How do you feel you're getting enough support?
Simple questions.
Simple questions, but they open the door. They can gently suggest joining new parent groups, remind them to prioritize rest and nutrition, and crucially, refer them to a GP if concerns persist. It's about that empathetic interaction.
That simple check-in that can make all the difference. Building a strong support network seems absolutely crucial for new parents, especially in those isolating early days.
It is hugely important. The good news is that New Zealand offers a wonderfully diverse range of social groups.
Like what?
You can find everything from pram running groups, music groups, coffee meetups, to more structured play groups, even specific young mums or dads groups.
The main benefit being?
Directly combating that sense of isolation, connecting with others who are navigating similar joys and challenges, creating that shared experience, you too.
Yeah, that sense of community. Beyond informal groups, there are some truly wonderful formal support options too, aren't there? Offering really practical help.
Definitely. Organizations like Bellyful, for instance. They provide nutritious meals for families with newborns or those struggling with illness. A total lifesaver for exhausted parents.
That's fantastic.
Multiples NZ offers a dedicated support network for families with twins, triplets, or more.
Makes sense.
And the Little Miracles Trust provides care packs and support for families with premature babies, often including lovely knitted items from volunteers, which is a really nice touch.
Oh, that's lovely.
And Breastfeeding New Zealand also offers instant expert advice online or over the phone.
And for easily accessible, on-the-go information right in your pocket. Any apps.
The WellChild app is highly recommended. It's packed with reliable information, lists local support networks.
Oh, and the immunization reminders you mentioned.
Exactly. It even provides immunization reminders once you input your baby's birth date. It's a great digital companion for new parents. Very useful.
Okay, let's shift our focus to some common newborn health conditions. While most are harmless, what are the crucial ones parents need to know about? And perhaps more importantly, when should they seek professional help?
Okay, good plan. Let's start with immunizations, which are, well, a critical public health issue in New Zealand right now.
Why is that?
While not compulsory, they are profoundly recommended as the most effective way to protect children against serious, potentially fatal diseases.
But we're seeing some concerning trends with declining vaccination rates, aren't we?
Unfortunately, yes, a definite decline. It's largely attributed to a growing anti-vax sentiment, which really seemed to gain traction around COVID vaccine hesitancy,
Right.
but also to ongoing access issues in some communities. It's complex.
And the consequences?
The alarming consequence is the reemergence of diseases that were once largely eradicated, like measles and diphtheria.
Things we thought were gone.
Exactly. Many parents haven't seen these illnesses firsthand and therefore don't realize how truly serious they can be. For instance, the devastating, debilitating effects of polio. It's a significant and worrying regression.
So what's being done to counter this trend?
Well, all immunizations are free, which is important. And the government runs catch-up programs to address missed vaccinations.
And if pharmacists are getting more involved?
Increasingly crucial, yes. Because of their accessibility across New Zealand, they're often a more convenient point of contact than a GP clinic for some families.
That makes sense.
We also see a particular drop-off in rates for older children, like 4 to 5-year-olds, once that regular well-child contact fades. So ongoing efforts to maintain awareness and access are vital.
Okay, shifting gears slightly to common, mostly harmless newborn skin conditions. What should parents expect to see? Things that might look alarming but aren't.
Right. First up is newborn acne. It's hormonal, looks a bit scary maybe, a little pimples.
Yeah.
But it's completely harmless and goes away on its own. Absolutely no need to pick or scrub.
Okay, leave it alone.
Exactly. Similarly, dry or peeling skin, especially in overdue babies, is just dead skin shedding, like your fingers after a long bath, It resolves without intervention.
And that rash with the long name.
Erythema toxicum neonatorum. Yes, sounds dramatic.
It does.
But it's just a temporary, normal newborn rash. Looks like red blotches, maybe with little white spots. Again, looks worse than it is, doesn't require treatment. The key distinction from something serious like meningitis is that the baby would also be unwell, feverish, lethargic with a serious condition. This rash happens in perfectly healthy babies.
Got it. And what about that scaly patch on the scalp that looks a bit like dandruff?
That's cradle cap. Very common, harmless, scaly rash from overactive oil glands.
What can you do about it?
A simple baking soda and water paste can sometimes help lift the scales, gently. Or you can just leave it. It doesn't hurt the baby and will eventually clear up on its own. Olive oil or coconut oil massaged in can also help loosen it before washing.
Okay. Nappy rash is almost an initiation rite for new parents, isn't it? What causes it and what are the best remedies?
It's extremely common, yeah. Caused by urine and feces sitting on the skin for too long, basically irritating it.
So frequent changes are key.
Absolutely. Frequent nappy changes, washing the area with just water, avoiding fragranced wipes, which can actually exacerbate irritation.
Good tip.
Thorough drying, patting gently, not rubbing, and giving the baby nappy off time. Let the air get to the skin. Sunlight can actually help here too, in moderation.
Oh, the nappy off time. I have a vivid memory of my baby learning to roll and, well, let's just say a shag rug got more than it bargained for during that time.
A classic parenting moment. Many can relate, I'm sure.
Lesson learned quickly.
Yeah.
What about barrier creams?
Yes, a good barrier cream is key for prevention and treatment. Zinc and castor oil or lanolin-based creams are excellent choices as they allow the skin to breathe while protecting it.
Avoid Vaseline?
Generally, yes, avoid petroleum jellies like Vaseline for nappy rash, as they can create too much of a seal, trapping moisture and preventing the nappy from absorbing properly.
Okay. When should you worry about nappy rash?
If the rash doesn't improve after maybe 4 days of good care, or if the skin looks broken, blistered, or infected, that's a red flag for a GP referral. It might need something stronger, like an antifungal.
Jaundice is another common condition that can look quite concerning with the yellowing skin. Why does it happen?
It is common. Jaundice is the yellowing of the skin and eyes due to a buildup of bilirubin. Babies are born with an excess of red blood cells from the birthing process, and their immature livers simply can't process all that bilirubin quickly enough yet.
And why is it serious if it gets bad?
It's important to take seriously because, if left untreated, very high levels of bilirubin can unfortunately lead to brain damage. Kernicterus is the medical term.
So treatment is needed sometimes.
Yes, if levels get too high. Treatment typically involves a day or two in the hospital under special UV lights, phototherapy, which helps break down the bilirubin so the body can excrete it.
Okay. And speaking of rest, or lack of it, what's a typical newborn sleep schedule like?
Yes, sleep. Newborns generally sleep a lot, around 8 to 9 hours during the day and 8 hours at night, maybe 16 hours total.
Sounds good.
But here's the kicker. They wake frequently, typically every 3 to 4 hours, sometimes more often, to feed. Their stomachs are tiny.
Not 8 hours straight then.
Definitely not. The crucial tip for parents, and yes, it's easier said than done, is to rest when the baby rests.
Oh?
Seriously, prioritize that sleep whenever you can. Forget the housework.
Sleep when the baby sleeps. The eternal advice.
It's vital for your own well-being and your capacity to care for the baby.
On a more somber note, New Zealand historically has had high rates of SIDS or sudden unexpected death in infancy. What life-saving advice is out there to prevent it?
Yes, while rates are thankfully coming down due to concerted public health initiatives, SIDs remains a serious concern. The life-saving advice centers firmly on safe sleep practices.
Okay, what are the key points?
First, always sleep baby on their back, not their tummy or side. This significantly reduces risk.
Back to sleep. Got it.
Second, keep the cot clear. No loose items like bumpers, pillows, duvets, or excessive soft toys. These are suffocation hazards. A firm, flat mattress with a fitted sheet is all that's needed.
What about blankets?
Position the baby with their feet at the bottom of the cot so they can't wiggle down under the blankets. Tuck blankets in securely up to their chest. Or, even better, use a baby sleeping bag of the correct size and TOG rating.
Takes the guesswork out.
Exactly. And I know a critical warning is around co-sleeping, isn't it? Sharing an adult bed.
Yes, co-sleeping in an adult bed is strongly advised against, especially if parents smoke, have consumed alcohol, or are extremely tired due to the high risk of suffocation a parent accidentally rolling onto the baby.
But what if parents want the baby close? Room sharing is recommended for the first 6 months, having the baby's cot or bassinet in the parent's room. And initiatives like Peppy Pods or Wahakura, woven flax bassinets, are fantastic. They provide a safe, portable sleep space that can be placed in the parent's bed, creating a protective barrier.
That's a great solution. Okay, let's talk about colic. It sounds like a real mystery and a source of intense frustration for many parents.
Colic is often described as inconsolable crying and fussiness, usually in the late afternoon or evening for hours at a time. It frequently seems linked to reflux or trapped wind, but the exact cause remains a bit mysterious.
When does it usually happen?
It typically begins around 2 weeks old and thankfully usually resolves by about 16 weeks. So there is a light at the end of the tunnel, even though it feels endless at the time.
What can parents do? Any home remedies?
Various things can provide relief. It's often trial and error. Keeping the baby upright during and after feeds, ensuring they burp thoroughly.
Burping is key.
Absolutely. Angling the cot slightly, movement like pushing them in a pram, using a sling, rocking, warm baths can help, gentle stomach rubs in a clockwise direction.
What about medications like gripe water?
Gripe water is sometimes used. Its effectiveness is debated, but generally harmless. Proton pump inhibitors, PPIs, strong acid reducers, are generally not recommended for babies unless there's a severe, clearly diagnosed reflux case confirmed by a specialist. Overused in the past.
Okay, and sometimes that constant, relentless crying can push parents to their absolute limit, tragically leading to something like shaken baby syndrome.
This is a stark and deeply important reality to address. Shaken baby syndrome is a severe brain injury caused by forcefully shaking an infant.
It's child abuse.
It is absolutely child abuse, and it can result in permanent brain damage or even death. The forces involved are devastating to a baby's fragile brain and neck.
So the advice for parents at breaking point.
The vital advice for stressed parents is incredibly important. If you're feeling overwhelmed and frustrated by a crying baby, put them down somewhere safe, their cot or pram, and walk away.
It's okay for them to cry.
It is absolutely okay for the baby to cry alone safely for a few minutes while you take a moment to calm down. Step outside, take deep breaths, call someone, a friend, Plunkett line, anyone, or ask someone else in the house to take over. Prioritizing that moment of calm can prevent an irreversible tragedy. Never, ever shake a baby.
Such crucial advice. Okay, what about watery eyes in newborns? Is that always conjunctivitis or is there another common cause?
Not at all. Watery eyes are very common, affecting about 1 in 3 babies. Usually it's due to a blocked tear duct.
How does that work?
The tears simply can't drain properly through the tiny duct into the nose, so the eye wells up. It may look red, weepy, or even have a sticky, pus-like discharge, especially after sleep.
Right.
But it's crucial to understand it's not usually an infection.
Does it get better?
Yes, about 90% of cases resolve on their own by the baby's first birthday. Gentle cleaning with cooled boiled water and cotton wool, and sometimes gentle massage over the tear duct area can help.
So what are the red flags for actual conjunctivitis where you need to seek medical advice?
For true conjunctivitis and infection, you'd look for signs like definite inflammation and redness of the white of the eye, a distinct thick yellow or green discharge throughout the day, the baby appearing to be in pain or bothered by light or persistent itching. Those would warrant a doctor's visit, as antibiotic drops might be needed.
Okay, clear distinction. And finally, teething. When does it usually start, and what helps soothe those sore gums?
Teething usually kicks off between 6 months and a year, typically with the bottom front teeth emerging first. It can then continue on and off up to age 3 as all the baby teeth, including molars, come through.
What are the signs?
Classic signs include swollen, red gums, more crying or irritability than usual, and sometimes a slight low-grade fever, lots of drooling, and a strong urge to chew or bite on hard objects. Maybe disturbed sleep, too.
What helps?
Relief can come from gently rubbing the gums with a clean finger or a cold, wet washcloth. Cold teething rings stored in the fridge, not freezer, can be soothing. Some babies like chewing on harder, safe objects.
And a word of caution regarding popular teething gels like Bonjela.
Yes, it's really important to use numbing gels like Bonjela sparingly and exactly according to instructions, especially age restrictions. There was a dangerous case of salicylate toxicity reported overseas for excessive use. Always follow the recommendations carefully. Less is definitely more. Paracetamol can also be given if the baby seems genuinely distressed or feverish.
Okay, so given all these common conditions and remedies, when do you know it's time to stop trying home remedies or waiting it out and actually refer a baby to the doctor? Because as we've discussed, babies can decline so quickly.
You've hit on the most critical point. Babies can decline incredibly fast. Their condition can change in hours. So the golden rule is, if you have any doubt whatsoever, if anything feels not right with the baby, or if your parental instinct is telling you something is off,
trust your gut.
Absolutely. Trust your gut and refer them immediately. Don't hesitate. It's always better to be safe than sorry.
What are those specific urgent red flags you absolutely need to look out for? The get help now signs.
Okay, critical signs include blue lips or tongue. Call an ambulance immediately for that.
Right, straight away.
Also, any bluish, distinctly yellow or abnormally pale skin or eyes. A red, pussy, or foul-smelling umbilical cord stump.
Temperature.
An extreme temperature, either a high fever, especially in a very young baby under 3 months, or being unusually cold. Less than 6 wet nappies a day, which is a strong sign of dehydration.
What about feeding and vomiting?
Frequent liquidy or mucousy bowel movements suggesting bad diarrhea. Repeated forceful vomiting, not just spitting up, or several refusals to feed in a row.
And behavior.
Any excessive sleepiness where the baby is difficult to wake, seems floppy or unresponsive, or conversely, inconsolable high-pitched crying. Any drastic, unexplained change in behavior. These all warrant urgent medical attention without delay. Go to the GP, after-hours clinic, or hospital ED.
Wow, we've truly covered a huge amount of ground today. From navigating New Zealand's unique support systems, the LMC, Well-Child, Plunkett, to understanding common health issues from nappy rash to jaundice, and the crucial aspects of mental well-being, the baby blues, P&D, during this transformative time.
Indeed. Gaining this knowledge, having this overview, is truly a powerful shortcut to feeling more prepared, more supported, and ultimately more confident as you embark on or navigate such a monumental period in your life.
And as we wrap up this deep dive, maybe something to think about. Given the clear evidence we discussed of declining vaccination rates and the concerning return of preventable diseases, what role might our wider communities, beyond just medical professionals, play in rebuilding trust and ensuring collective immunity for our youngest and most vulnerable citizens?
That's a really important question for all of us to consider.